All right. Hello, everybody. My name is Jamie Penza. Stephanie Engel and I are co-leads for the Waukesha County CHIP Substance Use and Housing Group, and we're presenting today with our community partner and project collaborator, Haley Nanonen. Today's presentation was adapted from our breakout session at the 2025 Waukesha County Partnership Summit, and it's called Choose Your Own Adventure, Advancing Partnerships at the Intersection of Substance Use and Housing. Our presentation will go over the path that our CHIP team took as we embarked on our quest to build an evidence-based, systems-level transformation product that could be used by multiple disciplines to make real changes for real people. Today, the three of us will walk you through our areas of expertise and research as we take a look at where we started, where we are now, and how we could use your help to take the next steps. But before we get into the data, I just want to thank you so much for inviting us to share our work with the Waukesha County Heroin Task Force and for your commitment to strengthening community health through collaboration, data-driven strategies, and bold community-led action. Next, I'm going to pass it over to Stephanie Engel to get us started.
Thank you, Jamie. Thanks everyone for the opportunity. I'm not going to go deeply into my bio here because I want to get into talking about the brilliance of Haley and Jamie. So just for the purposes of this moment, I'm going to describe the interwoven nature of the overdose fatality review program and how that intersects with the current CHIP cycle. If people haven't unpacked the acronym CHIP, it stands for Community Health Improvement Plan. It's on a 5-year cycle currently, and we are going into year 5 actually in 2026. My role, I'm a public health social worker. I'm responsible for the design and coordination of the Waukesha County Overdose Fatality Review. That team that I help to coordinate is essentially a multidisciplinary team that's intentionally comprised of a wide range of sectors and disciplines, where we really value also people with lived and living experience. They're seen as both pivotal and valuable to our work and the outcomes that we hope to generate. Our North Star for the overdose fatality review is to reduce and prevent substance-related deaths in our community. And we do so by reviewing substance-related deaths and identifying missed opportunities and systems gaps to become a more prevention-oriented community. Jamie, if you could advance the slide, please. So in August of 2022, this is probably information that people are well aware of, but I just want to set the context here. County Executive Paul Farrow declared fentanyl a community health crisis. And a directive of that health crisis was to establish a Waukesha County overdose fatality reviews. And the purpose behind that is to really acknowledge the urgency and importance of mobilizing together as a community to address the opioid crisis. Next slide, please. So this is a decades-long opioid crisis we're talking about. And what I want to just analogize today with this famous iceberg graphic that probably most of us have seen if you're looking at the sort of the right side of the frame there. Reported deaths are often the focal point of our dialogue that we talk about. This is often what we see. It's often what we acknowledge that's above the water level. Today, I just want to address what is really hidden or unseen and unacknowledged is the grief and trauma and socioeconomic impact that people are carrying around in their everyday life. So if you take a look at this here, one of the most recent studies looked at how many adults are survivors of substance-related loss or who has lost someone to a substance-related cause. And you see here it says 42%. So for every 2 people that you're meeting, I just want to acknowledge that hidden in the layers of their human experience are a range of challenges that you may never see. And this is often maintained because of the widespread damage caused by stigma. If you could advance, please. This is also a pretty infamous graphic that has been around for quite a while, and this really illustrates more of the narrowly the toxicological perspective related to opioids and the evolution of the opioid crisis. So the first wave you see is the rise in prescription opioid deaths. The second wave that you'll see in 2010 there is an increase in heroin-related deaths. And then in 2013, we started to see the rise in synthetic-related deaths, such as fentanyl. And it is well established among the scientific community that we are well into the fourth wave of this crisis, which is heavily characterized by polysubstance use, particularly fentanyl and stimulants. Next slide, please. So as you've maybe observed on the left side of the screen, we have just kind of a road that is cutting through all of these slides. And that was intentionally to get to this cross section here, as if, we haven't already established how increasingly complex the opioid crisis is, then we also layer in the complexity around housing affordability and availability. And here, what I really want to bring our attention to is really talking about rent burden. So the definition of rent burden is defined as a household spending more than 30% of their income on gross rent. And this is a common indicator that's used to measure housing affordability. And so you'll see here, specific to Waukesha County, 43.4% of renter households were considered rent burden in 2021, which was notably higher than the rates in the other suburban counties in the area and statewide. So noting both the opioid crisis and the housing crisis that we're facing, the strategies that we had developed as an action team, if you could advance, please, Jamie, were primarily focused on deepening locally available research to begin to understand some of those features that we could strategically target for impact and change. And this is where it all gets really exciting. As someone who has been able to work alongside many partners in a way that has been really collaborative and innovative, our multidisciplinary team came together and we decided we wanted to understand the available and accessible housing options through a comprehensive asset map. And then if you look at strategies 2 through 4, these are really all sort of clustered together in a way that we were looking to deepen our research and understanding. And so we were looking at this important intersection through key informant interviews, partnering with a research institution, and building an interactive game design. I'm really excited for you all to hear from Jamie and Haley, who are going to highlight those pieces. And all of what we were doing here, our sort of underlying intention with this interactive game that we're designing is the purpose here is to have professionals be able to step into the challenges that people in our community face every day at the intersection of housing and substance use. If you could please advance, Jamie, thank you. None of this could have been done without our compassionate and driven interdisciplinary team. Everybody who came to this has been attending routinely and helping us push this forward, and really helping adapt something locally that may never have been done before. And so their support has been incredible. We've had hospital partners, we've had housing partners, Impact 211, direct service providers, and this has also created a very robust lens from which we can operate and better understand the needs of our community. Next slide, please. So why do we need each other? These mutually beneficial partnerships, and this was really the focus of another presentation that we have done, is that we could not have done this without each other. Specific to Haley and Jamie, they're able to offer tools, support, and resources that might not otherwise be available. And specific to Haley, who is going to represent here today, Medical College, she was able to really help us turn a hypothetical project into applied research and data analysis, like really providing a tangible blueprint to impact and affect future public health practice and advocacy. And so I am very excited now to introduce you to Haley to share her findings.
Hi, thank you, Steph. As Stephanie mentioned, my name is Haley, and I'll be talking about the academic side of the partnership, as well as the research that helps inform the education module that Jamie is going to talk about. So in my day job, again, I'll go quick because I want to save that time for Jamie. I serve as a community outreach manager for Aurora Healthcare. I've been in that role for 9 years now, and I oversee local charitable giving and community investment, our community health strategy, and community benefit reporting. So a whole lot of community there. I am also in my third year as a student at MCW in their Master of Public Health program. And in January 2025, I began my field placement with the Waukesha County Public Health Department as an intern. So as we advance to the next slide, I'm going to talk a little bit about why we need each other from the academic side. So as you heard Steph mention, the Public Health Department and MCW each bring unique perspectives and strengths to the partnership. By working together, we embraced a mutually beneficial collaboration that strengthened data collection and analysis, our public health practice, and open collaborative spaces. So from the academic side, public health provides benefits that are not readily available in the classroom setting. So for example, public health provided students with on-the-ground professional training experiences that put theory into practice. So we spend years training and studying public health theory, and this public-private partnership provided an opportunity to gain real on-the-ground training that helps bridge education to practice. And then on the other side, local public health departments also empower students to connect with and serve communities directly. They provided an opportunity to directly connect with community members and stakeholders, as you'll see in a moment, and they truly understand the unique needs of their constituents. And this allows academia to build research and programs that are tailored and cultivate community-based participation. Because of this partnership, we were able to identify that gap in data that Steph briefly mentioned. Through the housing subgroup, we conducted research and we're using it to inform future work. So on the next slide, you're going to see a little bit about the project timeline. I am not going to run through it. What I want to make known on this slide, and again, this is kind of in reference to our previous presentation, but is to really focus on the fact that our partnership started long before the contract was signed in January 2025. We began talks back in September 2024 after the housing subgroup identified their need for more data, and we started dreaming up what a partnership could look like for both organizations. So for those on the call that are interested in working with an academic institution, the point of this slide is to really bring home that you should start planning ahead and begin those talks with those institutions well before you need that gap for additional resources filled. So on the next slide, I'm going to walk you through the research real briefly. I worked intentionally with the housing subgroup to determine the research question by narrowing down the data gap and the group identified. And we settled here with what systemic and service level gaps and nuances do professionals observe in supporting people who use substances and experience chronic homelessness? So there's that intersection that Steph talked about. So we did key informant interviews, and typically they're really focused on community leaders and stakeholders who often speak to system level issues for good reason. However, this group was specific in targeting direct service providers to really understand the nuances that exist in serving their clients and patrons. So we talked to first responders, direct service providers, healthcare professionals, social workers, and housing navigators. Phase 1 was all about defining the research question and methodology. Phase 2 was recruiting participants and conducting the interviews. And then phase 3 was the data analysis and determining the final results. So on the next slide, I'm going to tell you a little bit about what that data analysis looked like. There's a lot of words on this slide. I'm not going to read through them all, but we want to give you some context about how we got where we are and where we're going with it. So with the results from the key informant interview, I took all of the transcripts through a thematic coding process, which is just a really big academic way of saying we looked for themes and commonalities among each of the transcripts. So level one, which is there in the orange, is often referred to as open coding. I identified 140 unique codes or labels that help participants sum up a thought, sentence, or a point. So we started big and we're going to start narrowing down. Level two, also called axial coding, that is where the codes are sorted and grouped into sections. So you can see 7 groups were identified in this phase there in the green. And then each section had between 2 and 6 clustered. So we grouped them and then we grouped them again even smaller. For example, under policy impact, clusters included policy design and implementation, systemic barriers, and client vulnerabilities. The final level, which is the selective or thematic coding there in the blue, level 3, is where our 4 overarching themes were identified, and that is support for professionals, harm reduction and housing first education, landlord engagement, and balance of power. A really quick note on research limitations. I'm not going to run through it all because of our time, but just know that there are limitations to this research, primarily me being a singular researcher. Obviously, in higher level evaluations, we would want more people at the table discussing bias and interpretation of the results. The other piece is because it was a singular researcher, we had a relatively small informant pool, but special attention was paid to avoid confirmation bias. Because affordable housing and substance use is a well-known issue within Waukesha County, that is why we spent so much time upfront on the methodology, preemptively discussing confirmation bias and interpretation. And then also, subjectivity is always at the forefront when you're doing interviews like this and you're asking people to recall their experiences. So we were very upfront about potential for bias and we tried to mitigate that where we could. And then my next slide just pulls out one quote, and I am going to read it and I'll be quick, but I think it's important for this group to hear it. So this is what one participant said, quote, "We need to invest in meeting the moment in 2025 and rebuilding systems with people who have lived experience at the center. I think when communities face turmoil and we are in deeply troubling, problematic times, it is then that communities start to band together and find strength in one another." And I read that to say this, all of the things that have happened up to this point in the community has brought us closer to this opportunity. You saw the 3 opioid waves that Steph discussed, the overdose crisis announcement in 2022 prompting OFR, the CHIP team embracing a difficult intersection of substance use and housing that needed attention. So we faced questions and hesitancies by really well-intentioned people who understand how complex this intersection is. And so we were realistic about it. We know we cannot solve the system ourselves, but we can start working on foundational actions that help move community health forward. So that's what we did. On the next slide, we looked at those 4 themes together as a housing subgroup, and then we chose 2 that stood out, and that was support for professionals, that's where the education piece comes in, and then harm reduction, because we know that's essential to meeting and serving community members and clients where they were at. So I am going to breeze through this last slide because I want to leave Jamie a solid 10 minutes to talk about what the module is going to look like. But essentially, once we had the final results, I was then able to start diving further into learning theory and the research surrounding it. And we landed on transformative learning theory. This is a theory that was developed by Jack Mesereau in the 1970s. It is specifically an adult learning theory focused on change through critical thinking. So it starts with providing learners with a disorienting dilemma. So that's kind of this game that you're going to see. And that helps prompt self-examination of personal beliefs and assumptions. And so by using techniques like case review, mock role play, which is what this is, and debrief, all of these are also learning activities that are embraced by the health industry or health professionals. Learners are guided through the critical assessment of their assumptions to help build a new worldview and acquire new skills, essentially harm reduction, acceptance, and uptake. So there are 4 areas that are central to transformative learning theory. I'm going to touch on them very briefly. Facilitation and learning environment. It's really crucial to have leadership support as we embrace or as we went on this journey, and to balance the power between the facilitator or expert and learning and learner. Because we're placing learners in a vulnerable position through simulation, we need to ensure that they are in a comfortable and safe environment. Um, and the next one I'm going to talk about, I'm going to skip a little bit. The next I'm going to talk about is the learning and the experiential simulation. That's 2 and 3 there. They really go together. And that's the mock role play through simulation that Jamie is going to talk about. This really helps players learn to adapt in an unfamiliar situation and think differently about things gone wrong. And that's where critical self-reflection really starts to weave its way through and start with perspective growth and transformation. And then finally, on the fourth piece, which will be down the line, is about evaluation. Transformative learning theory really benefits from what we call a mixed methods evaluation. So we look at both quantitative, which is like the hard and fast descriptive numbers, but we also look at the qualitative, which is the research I did, and beyond. Because we're talking about personal growth and transformation, it's hard to narrow it down to I agree with this statement, somewhat likely, not at all. And so it really takes talking with groups in interviews, doing case studies or focus groups to be able to understand what personal transformation looks like. I could talk about transformative learning theory all day, but I am going to take a moment now to take a breath and then pass it over to Jamie, who is going to walk you through the product design.
All right. Thank you. And amazing work, Steph and Haley. As I said before, my name is Jamie Penza, and I'm a co-lead for this CHIP team. I work as an emergency preparedness planner for Waukesha County Health and Human Services in the Public Health Division. And I'm also not going to go through my resume, but you can skim through this slide if you're interested. I have a background in education and public health. I'm not a subject matter expert in substance use or housing, and I don't interact with clients or service providers on a regular basis, but I do have a unique skill set that I brought to this group as well. With a strong background in public health, education, injury prevention, coalition building, and group facilitation, I was able to help with some of the organizational pieces for our group, and I asked a lot of clarifying questions. I helped to synthesize the research and expertise into a tangible product that we could share with others. And because of my work in emergency preparedness, I was able to leverage some of my unique professional partnerships and provided an outside perspective to our subject matter experts. But most importantly, to this project, I had access to some pretty cool technology that we're using to build an interactive simulation and learning module. So when our CHIP team was talking about what we wanted to do and how we wanted folks to experience what it might be like to be at that intersection of substance use and housing, to be able to really walk in their shoes, I was reminded of a conference session that I attended at the NACHO, which is the National Association of City and County Health Officials Conference in 2023. Minnesota Department of Health had a presentation that they did in collaboration with the School of Public Health in Minnesota. They presented a session on some immersive learning games that they had created to teach people about what it's like to be a disease investigator or what it's like to be an incident commander during a devastating tornado that wiped out several community lifelines. These games allowed you to become the character, and then you would navigate through different scenarios, making choices and learning along the way. If you look at this map, you can see the incredible reach and impact that the games have had nationwide, and they're still continuing to grow. This is a slide from 2023, so I'm sure it's been even more utilized since then. But the darker the blue, the bigger the reach. And the numbers are tiny and it's hard to tell. But remember that this started in Minnesota. And look at how much the dark blue has reached Texas, California, and all across the country. So I was thinking, hey, if they did that with this, think of what we could do if we built something similar for substance use and housing folks. I have a license for the same software that they used, and I suggested to the group that we try it. I'd never done anything like this before. Like I said, I had the license, but I never even opened the program. But I figured if they could do it, we could do it, right? How hard can it be? So the first step was deciding on the audience, the objectives, and the data that we wanted to include in our simulation game. We had a meeting and we put these giant Post-it notes on the walls. We talked through all the data and research that Haley and Steph shared with you, and all of our partners in the room are from different agencies and different lines of work, and they had ideas and stories to share. So we went around the room, and you can see the squares on this slide represent the giant Post-it notes that we had put up on the wall. And we started gathering ideas, and we were drawing on the whiteboard and mapping out what the simulation could look like. It started to get really complex. And at one point, it was so hard to keep track of all the ideas that instead I developed a shared spreadsheet so that our subject matter experts could fill in the data and reference sources that relate to each interaction that you would have in the game, so that everything that we're building is backed by data and real world experiences. So this is what it kind of looks like. When you start out, you start with something which is called the game of impossible choices. As we were starting to develop this, we were like, what do we want to happen? And we said, well, we want people to know what it feels like. And some of these people do face impossible choices. And so that was it. We knew that we had our title. So Game of Impossible Choices is where the player chooses a character, and every choice that they face doesn't work out. So we do have a disclaimer that we're building in that this is not everyone's story, but it could be someone's story. And there'll be a link to all the data sources on the bottom of the slide so they can see where this comes from if they want. And there's also a skip button if somebody needs to just advance directly to the modules. After experiencing this discouraging scenario, players are going to learn about prevention measures or programs that can be implemented to improve the outcome. So once the learning is complete, then they're going to come back and play the exact same again, the same game again, but now instead of a game of impossible choices, it will be a game of what if. What if we implemented these changes into our fields? It's still not going to be everyone's story, but it could be someone's story. And our hope is that the journey leaves the player feeling hopeful, encouraged, supported, and empowered by the resource and data that we use to design this. So looking at this example on this slide, we've got a person in this case that was prescribed a medication that increases their chance of a job-related injury. This could be anyone. This could be a worker. This could be any field. No matter who you are, you have two choices. You're either going to take the medication or you're not going to take the medication. If you decide to take the medication as prescribed, or you decide not to take the medication as prescribed, when you're playing Game of Impossible Choices, it doesn't matter. You're severely injured at work. Your emergency room blood tests reveal medication in your system that warn against operating machinery. The person in this image is concerned because he knows that this is going to negatively impact his job. After you learn, and so some of the modules will teach different lessons, and that's going to relate to these slides. One of them could be workplace-friendly recovery support policies. And so after learning about that, when they go back and they see this same scenario again, you're going to see the same two choices. Knowing that last time it was disaster for you, this time, what if those policies were implemented? Again, you either take it or you don't. It doesn't matter what you choose. When this person makes their choice, they see that they're comfortable talking to their employer and learning about choices available. Openness around injury prevention and mental health is supported through recovery-friendly workplaces. So no matter what happens, they feel okay talking to their employer about it. And so that's kind of where this connects. And there's many, many scenarios that we are building based on the different folks that helped us to make the slides. We have a lot of different scenarios like this, but it's all going to be connected to the learning and help people to move from impossible choices to what if and hope. On the back end, if you look at this slide, this is what the storyline module looks like. Building the modules is much like building PowerPoint, but instead of going from one slide to the next, you can add new connections and branching paths and a bunch of different triggers like clicking on a button to advance to a new slide or to watch a video. You can have interactive rooms where you can click on things and it'll pop up different choices or information. So it's super interactive and fun, and it feels more like a video game when you're playing it than a boring learning module. So we're hoping for that impact and engagement. So because of the level of complexity and subject matter expertise that was required to build this project, it took a ton of collaboration and coordination. On the screen, I've listed our work group members that were involved, and I want to publicly thank them once again for their contributions to this initiative. We have more work to do behind the scenes to get everything finalized, so our expected launch date for the final version of the game is fall of 2026. But we hope that you will consider partnering with us. This is the part where we need your help. We need folks that are willing to pilot test the game once it's completed, and folks that are willing to share the final version with their networks and colleagues. So if you don't mind using the QR code on the screen or the link that is in the chat, we would like you to fill out this very, very brief survey, and everything's optional on there, so feel free to click on or answer whatever you're comfortable with. There's going to be an option for you to sign up to help us pilot test it, sign up to share it with colleagues when it's done, and also a spot for you to leave feedback about what you've heard today. If you have questions about the project or suggestions after hearing what we're up to, we would love your feedback.